Yeah. You mentioned rural a lot, and it's something that I'm in New Jersey. I don't hear that a lot, but New Jersey and Vermont are very different. So I'm wondering, like, what is like rural healthcare, rural economy?
It depends on what part of the country you're in. So rural is always going to be defined by having not that many people per
Hmm.
square mile. It looks different in different parts of the U.S. Though out west you may have a couple of large towns and large swaths of space in between them with either some very sparsely populated towns or no populated towns.
Mm.
In Vermont, it's less that and more simply that no one place is all that big, right? So we have a city, Burlington, that is our largest, and I haven't looked at the census recently. A, the Burlington metropolitan area is around 55,000 people. I think
Mm.
that Burlington might be 38, 35. So we're not talking Manhattan here. And then there's a pretty quick drop off after that. So, for example, I live in the capital and we have about 8,000 people.
Mm.
Uh, and that has different, just simply lack of people. So, when you're looking at healthcare and you are looking at, say, access to specialty care, if you're living in a rural place without that many people, that means that not that many people are going to be developing the condition for which you might need a specialist. So, you would
Mm.
have to look elsewhere to get that support or find some other way to deliver that healthcare. And so there's a lot of discussion of workforce or telehealth as access or crossing state lines to seek your healthcare access because we are a very small state geographically, and it introduces those issues. And then often the economics situation of a rural state might be shaped by natural resource economies, uh, either currently or historically. So
Mm.
in Vermont, that has been a lot of agriculture. If you're going to do policy in Vermont, you should have an opinion about supply side management for dairy pricing systems, for example. And so
Interesting.
that would be the other way that I think it really manifests itself in having different considerations if you're going to be in the policy field.
Yeah. Wow. It's the topics that I don't hear in New Jersey, where the healthcare is everywhere. Massive healthcare systems, multiple massive healthcare systems, specialists everywhere. It's hard for me to wrap my head around the idea of crossing state lines just to access a specialist versus crossing state lines to access the top of the specialist that out of the pool that you have available.
Yes, and nor do we have many pharmaceutical companies, unlike say New Jersey, right?
Yeah.
So there's also add-ons to that. Healthcare is an industry that's not just the care that's being provided to you, but there's a whole nexus of work involved in that. And if you're in a place that's very rich in that industry, you have a lot of add-ons as well.
Hmm.
Not so in Vermont.
Yeah. It's hard for me to fathom, but that's a reality for not just Vermont, right? Many other states in the country, I think, don't actually have the benefit of any specialists that they would need within a 25-mile or 50-mile radius.
Sure, and we have it pretty okay in Vermont. Boston is not that far from many areas of Vermont if you're in a
Mm.
non-emergency situation, right? So we have proximity that other rural regions may not have, but with that comes a different set of issues like interstate licensure, for example. So there
Oh.
are different access issues depending on where you are. But right, when you look at, say, the Primary Care Association and the FQHCs that we serve, about a third of Vermonters get their primary care from one of our members, which is a little bit broader than the FQHCs, but it's a sizable percentage of the population. And one of the reasons for that is that when you live in a place that doesn't have a lot of people, you don't have the business case necessarily to set up a comprehensive, high quality primary care center without additional assistance from the government to subsidize that opportunity.
Mm.
And so we are fortunate in that we do have a very strong system of FQHCs and primary care providers. it's not like you have a lot of choice, right? When I was growing up, I did not know that there was such thing as choice in who your primary care doctor was. I thought it was like a school district. You're just assigned to this community health center, and that's where you go.
Wow.
I now know differently. Before anyone's worried about my policy credentials here, I have since learned that is not true. But it never occurred to me that this would be something that worked differently when I was a kid in rural Vermont.